privilege to have Dr. Alex Summers with us on this round of Food Bites. Alex, I met you at a press conference a couple of weeks ago. I saw you again after that at a Governor General's event. But I know you've been with us for 4 years, but I just discovered today that you got your master's from Harvard. Is that correct?
I did.
You
I
did.
did.
So you're the chief officer of medical health here for London and at Middlesex-London, and we're glad you're here. But you've been here for 4 years, I think. And
Correct. Yeah.
you and I have similar backgrounds. We both were raised in Calgary, so I found that really interesting as well. The last time we talked, can you just give us a bit of your background, Alex?
Yeah, for sure. And Glenn, thank you for inviting me to be part of this today and for your ongoing work and leadership in our community. So, yes, I've been here at the Middlesex-London Health Unit, our public health agency for our community for the last 4 years. I was the Associate Medical Officer of Health until March of this year, and then I've since been the Medical Officer of Health. Prior to that, I spent some time in Toronto and down in Boston and Kingston, but was born in Calgary, Alberta, before moving east as a late teenager and spending the rest of my years so far here in Southern Ontario and in Ontario.
Yeah.
It's been wonderful to get to know the community over the last 4 years and to get to know our organization and your organization and the work that we all collectively do to try and make our community a healthier place.
Yeah, no, that's great. I'd like to pivot to that a bit, just about because I think people need to know that the health unit really does partner with a lot of different groups, including the food bank. So we partnered with the Middlesex London Health Unit for a fair while. We've cooperated on a number of different issues, things like harvest bucks. Also, the mayor's anti-poverty panel a few years ago, the health unit was on that, the food bank was on that. So we've had a fair bit to do together, which I think is really great. But since you have come in, I mean, you came in and kind of took over as COVID was there, but somewhat receding. But how do you think that the partnership level of things went with the health unit over the course of COVID? Like it seemed to me you folks came to prominence really as was only right then, but you also, I'm sure, had to then link up with different people in different ways. I know when the health unit first met with the food bank at the beginning of the pandemic, they said, "Look at you guys, you can't close down. We really need you to keep getting the food out there." And the health unit said, "Anything you need, we'll provide it," which we really appreciated. But I think that took our partnership with the health unit to a whole different level. We weren't just partnering in an equal way as we had in the past. The health unit was suddenly prominent. Did you get that feeling with other partnerships during the course of COVID?
Yes, we did. I think the pandemic certainly highlighted for us and also for the community um, the critical part that partnerships play in public health. And one of the things we know to be true as a public health agency is that we do nothing alone. One of the key things when we talk about health is that health is so much more than the hospital in your region, although our hospitals play a key role. Health is actually influenced by lots of things that aren't health care. They're influenced by the schools you go to, the streets you walk, the grocery stores available to you, your income, the price of the food you're trying to buy. The
Hmm.
list goes on and on. And therefore, as a public health agency that's trying to protect and promote the health of our community, we by our very nature need to collaborate. And through the pandemic, we saw that as a community tried to figure out how to protect itself and others from this virus. And those relationships that we have been able to expand upon through the pandemic, be it with the food bank, our municipal partners, so the City of London, the County of Middlesex, our school boards, we built closer relationships. We've seen the trust that has built from people saying, I don't care what organization you're part of. We're all aligned here trying to do what's best for our community during a really tough time. We've seen some of those borders come down, and I hope they can stay down as we try to align ourselves around the community. That's what really matters in the work that we do, not the organizations, but the community. And we saw that come to light during the pandemic when we really had to do that. And I think I'm really encouraged and hopeful from that.
Yeah. It's interesting. I think recently, in recent years, as the political influence in the country has become more divisive, I think that there has been more and more of a desire from even leaders like the Governor General or others to try to find a counter narrative that can run with that. So yes, we look to politics and governments to help us with certain things, but really it's at the civic level, at the community level, where we have to develop new and innovative kind of partnerships that don't reflect the partisanship or things like that are often obvious in the political arena. And it seems to me that the health unit, Middlesex-London Health Unit, has become more prominent because of COVID, but it seems to me that it must remain more prominent because as we look into communities to find solutions, it's not just with the Minister of Health in Queen's Park or the Ministry of Health, in Ottawa and Parliament. It really is at the local level. And the thing for the health unit here is it really is a public piece. It's like the food bank is a public piece, right? They're all pieces of these puzzles that are lower hanging fruit where people can access them easier or whatever, but that they become part of a new narrative in which as communities begin to, we used to talk about building back better at the beginning of COVID, right? Or doing things in a different way. Some of that has gone by the wayside, but it does seem to me that we have a responsibility, all of us as organizations, to consider looking past the regular ways that people would define, say, food insecurity for food banks or health for health units. Do you feel that now that the pandemic is waning, do you feel that the health unit itself is still in that position, or do you think it's kind of waning now as COVID is, or do you feel that these partnerships that are now there are now strong enough that we can move forward and kind of redefine public health in a new way?
Starting at the end of your question there, I do think that the relationships are going to be sustained. I think it's going to require intentional effort from us at the health unit as a starting place to continue to foster and build those relationships. Health, in some ways, is one way of describing what we all strive for, be it quality of life, health, vibrancy, vitality. We have lots of community partners that are actually working for the same ends that we as a public health unit are, but using a different term in terms of the outcome: vibrancy, livability, economic viability and sustainability. The words and terms go on and on. For us, we use health to capture that, but in so many ways, it's actually the same outcome we're going for. And that came clear through the pandemic that, in fact, to be healthy is to be happy, is to be caring, is to be part of community. And so those relationships that we've built, I think, as the health unit, one of the things that's really important for us to do is to use the terms that our partners know to say, actually, we're aligned. When I say health, I want a vibrant and busy downtown in the city of London. When I say health, I want a vibrant county where people of all stages are able to access the services they need. When I say health, I mean schools that are open and full and where people are reading and writing and learning. That's what I mean by health. And so I hope that as we exit the pandemic as a health unit, we are speaking the language that our partners are speaking and meeting them where they're at because our objectives are so aligned.
Yeah. That's pretty eloquent what you've just said, because I think I remember when SARS happened way back when, and the health unit was heavily involved then in the news and things like that a lot. But then as it receded, the health unit's visibility also receded at that point. The work continued, it kept doing the awesome things, but as people started looking community again, that wasn't a part of it. And we've got to make sure that that doesn't happen this time, because I think what I learned through COVID, and Jane did, and all of us at the food bank, is that I don't think we would have known how to move or how to operate if it hadn't have been for our partnership with the health unit, because it was a field we did not know or understand, right? And I think So that's great, and I think others did that as well. But we're now in a point where there's the mayor's panel on poverty, for instance, the local, the London COVID Recovery Network that it's called, right? That the health unit's on, the food bank is on. But we are trying to find new ways to define ourselves as a community. And I think what you've just said, I think is actually fairly profound, because I think you're talking about the health unit taking on that language of other organizations, but it's actually those are things you've always believed in all along. It's just more or
Always.
less that the rest of us have not made that link. Do you feel that?
One of the, yes, I agree. One of the eternal challenges of public health, and certainly a local public health agency like the Middlesex-London Health Unit, is that when things are okay, when there's not a crisis, or when, for example, there's not an infectious disease contaminating a food supply, or when the water's okay, that's when public health is invisible.
Yes.
When the public's health is good, the public health agency is invisible. We, by our very nature, one of our challenges is that the less you hear about us, the better things might be going. And that's a good thing in the big scheme of things. And it's, I think, a natural evolution. I don't expect the health unit to be in the news as much as we've been in the news, which informs actually part of the critical strategy we have to have as a health unit moving forward, to be out in community at the tables where the discussions are now happening, rather than having the discussions constantly come to us. And we've done that. We've, I think, have a legacy of doing that, but we have to renew ourselves in doing so and be at the table and continue to say, we have to do these things to keep ourselves healthy so that you don't find us in the news again. What happened after SARS or H1N1 or Walkerton is, you're quite right. Public health often fades from the collective memory. Some of the protections that and the lessons we learn at the time sustain themselves. Safe water, as an example, following Walkerton, has largely sustained itself as a protective infrastructure that continues to ensure safe water for a majority of communities, but not all communities, as we know from Indigenous communities across this province, but has sustained itself. But other safe measures waned. The desire for a comprehensive vaccination reporting system following H1N1 never materialized.
Yeah.
And yet it would have been really helpful to have for COVID. So I hope that we remember some of those lessons. I think having some of our community partners speak up for public health as we start to fade will also be helpful. And part of that is recognizing that we do share that same objective.
Yeah.
So just because you're in the education business, or just because you're in the food bank business, or just because you're in the business, you actually have the same outcome objectives as us in public health. So keep us in mind when we're having those conversations about what it means to be a vibrant, healthy community.
You know, I really have to agree with you on that. If I can just be honest with you, when the pandemic hit, I mean, Jane and I, we've been around a long time, leading the food bank for a long time, but we were suddenly in unknown territory. So, but I think it's really been through the mayor's panel, in which we talked about poverty as in other areas as well, or especially I think in my recent talks with you, which have been so educational to me, Alex, and it's true. You know, we talk about that. You know, the food bank runs as though hunger is the main issue, right? And we're trying to satisfy that, or food security, and we're trying to do the best we can, and that's really true. We're flat out all the time, ourselves and the volunteers. However, you have introduced to me, and I've really appreciated these ideas that, you know, poverty is also about health. You know, if somebody doesn't have enough money or somebody doesn't have enough food, breakdowns begin to happen, right? It could be in family life, it could be in health, you know, a breakdown physically, all of those kind of things, kids' retention in school, all of those things are essential. And yet, I think moved through most of my 3 decades of food banking, not so much making that as much a priority. I've focused on the hunger issue. And I think in that, I've probably made some real mistakes there. And I think one of the advantages of COVID is that it really helped me to get to know people like you and others at the health unit more, almost as if though you're waiting for an invitation, like, Glenn, the next time you guys have a press conference, bring us along because we're really interested in schools and hunger, nutrition, those kind of things as well. Or, you're working with Oneida, but they still have boiled water capacities. We have thoughts on that as a health unit, things we want to do. And those are things that I've been really remiss on. I presume others have been to a certain degree as well. But I think it's really true what you're saying. My knowledge of the health unit is that it's essential, but it sometimes hides behind its own shadow. It lets the other things go on. But that's because it's not your job to be out front, to be in the media all the time. In an emergency, of course. But it seems to me it's more that we as agencies have to recognize that the fields, the specific disciplines we're in, and the fields that we are in, all have a common denominator, and that is health. And unless we bring the health unit in, people won't recognize that. And I think we really need to do that. And that's kind of where I'd like to go with you for this next little bit. I'm wondering, in the way that we define poverty so often in the past, it's largely been economic, or there's been terms, indicators that spark things like a child poverty, or we say homelessness and we think that means somebody without a house or a place to live, those kind of things. But really, I'm wondering if it's not time to begin to develop a new language, that the thing that those things all do have in common is health. Without health, nothing else works, even if you do have a great economy or all of those other things. Have you done much thinking about that? Because you certainly caused me to think about it, and I appreciate it. But this idea of pivoting, of making health more of an integral thing of all of these aspects of poverty that we so often talk about. How are you feeling at the health unit? Are you trying to move them in that direction? I don't think I've asked you that question, but is that how you feel?
Yes, it is. Health, defining health is an existential challenge for many, and is something that has shifted over time. Backtrack 50 years, health was the absence of disease.
Yeah.
Over time, the definition of health has really replaced itself, and the World Health Organization speaks of this, the Public Health Agency of Canada speaks of this. Health is not simply that absence of disease, but the presence
Mm-hmm.
of the physical and mental and community capacity to thrive. That's health for me.
Yeah.
And what impacts your physical, mental, and community ability to thrive is so much more than your genetics, so much more than your access to healthcare. Although those things matter, so don't let me say that they don't matter, but it's more than that. It's the social determinants of health, a term you may have heard before. It is fundamentally influenced by how we design our cities, how we design our counties, the speed limits in our roads, the quality of education, the income redistribution plans, whatever those are, but those impact health outcomes because they impact people's ability to have the physical and mental and community capacity to live the thriving and vibrant lives that they would desire, i.e., to achieve full health. Yeah. So as a health unit, one of our challenges is that health touches all things. Our mandate states that we are to protect and promote the health of our community. That takes us into what I would describe as a near infinite mandate in some ways. And it requires, therefore, cooperation and shared expertise to say, I don't know how best to teach a child how to read. I don't. But I know from a health outcome that if a child doesn't know how to read, their opportunity to achieve full health will be greatly limited. Yeah. I know that if a child doesn't have opportunities to eat well, or if a child doesn't have income as a family in order to have stability and secure attachment with parents, families, friends, or otherwise, that their opportunity over a lifetime to achieve full health will be limited. So therefore, our partnerships with all those partners we've talked about is absolutely essential because, in fact, the education sector or the food bank sector or the housing sector has the expertise that I don't have. I know how to stop infection prevention and infectious disease transmission. I really do. I know it inside and out. I don't know how best to teach a kid how to read, but I can tell you both of those things are absolutely essential to getting health achieved.
Yeah. It's a learning time for you as well, right? Because as you do extend those relationships, let's say like with the food bank, as we go forward post pandemic, I mean, I'm already learning so much about this stuff, but I think for you as well, as you reach out into these different areas, you suddenly learn it's not just about, the specifics maybe about education or about food in schools or whatever it is. It's the politics of it, right? All of those things, because they're so important, whether it's housing, whether it's poverty, whether it's unequal pay between men and women. For instance, as the pandemics has been so much worse for women in the ability to be able to come back, to their full job capacity as they wish, because the pandemic disrupted so many different things. But I do think that as you move into those areas yourself, you're going to have to learn a lot of that, because we're all dealing with that the same way as you are in the health sector. We're dealing with that and the other things, and so therefore dialogue is going to have to be really important.
Dialogue, and I hope a significant amount of humility,
Yeah,
and through that humility, an acknowledgement that we may not know everything, even in our own sectors, let alone in others' sectors, and a humility that there is shared objectives, but unique expertise that comes with it. And I think as a health unit, we need to, and me and my role, commenting personally, like need to be in that humble position to learn
yeah,
and to engage. So, because again, if we pretend, I'm of no help to anybody to come out and say, you got to teach a kid how to read and I'll tell you how to do it. When the reality is there's probably a lot of different ways to teach a kid how to read, and I probably don't know the best one.
yeah. What's interesting at a global level, I was involved a fair bit with the UN as we developed the Millennial Development Goals all those years ago, and now the Sustainable Development Goals. And the earlier emanation of the Millennial Development Goals took poverty around the world and defined it in ways that were outside of what we would normally think of. It would include things like contraception for women, for instance,
Yep.
the access to education for kids. And suddenly, this whole thing that was about poverty became all of these other things and branched out. And then they became the Sustainable Development Goals, right? Which was the next emanation of all of that. And I was involved in all that. And it was really something to be part of that with people who really saw the world that way and who saw poverty that way. But then you start dealing at the local level, and people they see poverty as poverty, right? They're not making those broader links. And I've worked here with others, so as the food bank, other organizations, including the health unit, to get those sustainable development goals out there, help people to see that this is all mixed together. And unless we're, uh, you know, succeeding in all of these different levels, something will continue to break down. How important were those sustainable development goals to you folks as a health unit? Were you part of all of that, or was it something you just absorbed?
Some of the initial involvement of that preceded my time at the health unit, and since my time here, the pandemic has really trumped a lot of consideration in some of those ways. We're heading into our next round of strategic planning starting next year, and that aligns with. I know I can speak for the city's strategic planning process, and the county will be in and around there as well. And tying what we do locally here to the UN Sustainable Development Goals
Mm.
is I think critical. And I know I know that the city's previous strategic plan did. Um, as you look at those UN Sustainable Development Goals, I think that's for me what speaks to me is again that shared language or even unique language for shared outcome, right? Those are health outcomes, those are health determinants that are being talked about there. And so for us as a community, in some manner or form, to be able to apply a vision and shared mission to try and achieve those goals in our community would be amazing.
Yeah.
Because if we are able to secure those at a local level, we will have that vibrant community we wish for. And I think one of the key takeaways that the pandemic showed us is that there are absolutely global level impacts on the health of specific communities, and we know that
Yeah.
clearly. However, we minimize the impact of local interventions at our own peril.
Yeah.
The local work is what to me, matters the most. You know, we can wait for somebody at a upper jurisdictional level, be it provincial, federal, or global, to do something, or we can say, right now in our community, there are people who aren't achieving those UN Sustainable Development Goals, and we collectively aren't going to abide by that. Our pathway to addressing it can be a
Yeah.
source of much discussion, and
Yeah.
should be. But to agree that maybe that's not the outcome, not the community we want, I think that's something I would hope for our region.
Yeah. I mean, you really got my mind thinking, not just now, but before. But I really do think when you define poverty as economic, you stratify all of these different sectors within society. If poverty could be seen through more of a health lens, that's all of us. We all have that, and as we age, we go through different aspects of health and maybe breakdown or recovery or whatever it is. But I think we need to talk more with you folks at the Health Unit. I don't just mean the food bank, but all of us. I think we need to have a new language around poverty that's more rooted in health than it is just in economic things, because that becomes way too easy to just define if it's economic. But when it comes to health, it's much more integrated with where all of us are at. Would you agree with that? I presume you would.
I certainly would, Glenn, and I think part of it is just, from where my entry point is, right? My entry point is through health, and I can tell you, poverty is a absolutely critical predictor of whether or not somebody is well or ill. Period. At every stage of life, every stage of life.
Yeah.
To have access to the sufficient resources to have your physical and mental and community capacity to thrive is essential.
Yeah. Yeah. Well, Alex, it just came out in the news today that University of Toronto put out this new study that showed that Canada actually fared the best of all the G10 nations as we went through the last 2 years of the pandemic. Now, that also included economic measures, but primarily it was around health measures, knowledge, how we handled the vaccine, the ability to speak to people's insecurities and what to do and to give direction. Canada actually fared better than anybody else. And I presume that a lot of that, it's easy to look at the national level, but I presume a lot of that came through the really hard work of the public health units across the country, who were basically contracted to go out and make those things happen. And I think for all of us, I know for all of us as a food bank, it was the health unit that actually gave us this feeling of assurance as that we move forward. I was so glad that Kim Lupus, who works with you at the health unit, is on our board at the food bank, but she was assuring us or guiding us as we moved along. But I think all of us as a community really need to thank you, Alex, your staff, and your predecessor, Chris, and others. I think there's a reason why we did better than the other 9 nations. And I think a lot of that is not just due to this professional health thing, but the public health. How the public behaved and responded to the challenges that were before them was really due to the instructions and the assurance that you folks gave. So just in closing, I just want to thank you for that, Alex. I know that you were part of that. You've been here for 4 years, so you've been there for all through that stuff. But to you and your staff, thanks for that. There's a reason why we ended up where we did out of the G10, and I think so much of it, and here in London, is due to you folks. So thanks for that, Alex.
Privilege was ours. Thank you so much, Glenn.
And thanks for this interview. I appreciate it. We'll circle back to you because we got lots to learn together.
I look forward to it. Thank you so much.
Thank you, Alex. See ya.